I was bitter because I'm a Nigerian. I do the same job as well. And like I always say, if you don't have a passion, it doesn't have to be LK. If you don't have a passion for a certain job, you will not be successful at it. You will always. Hi everyone, welcome back to my channel. My name is Wemimo. I'm also known as that mom of 5, and I'm also known as TMO5 Co. If you're new to my channel, welcome, and if you're a returning subscriber, thank you for always coming back. So I just want to say thank you to the extra 2,000 subscribers I've got on my channel. I really appreciate you all. You all are the real MVPs. Thank you all for joining my family. So on this channel I shared my story of while I was a nursing student. I'm sharing my journey as a student, as a nurse right now on this channel, and also on TikTok. I'll leave my TikTok handle here. And I also, when it comes to health care, giving care to vulnerable people, it is not limited to just one ethnicity alone, because obviously a couple of videos I did back about the 4 Nigerians that were jailed, lots of people actually came into my DM to say trash. Some came to threaten me, some came to drop bitter words to me, but it's not going to faze me. And when I see, I've not actually come out with that video because they were Nigerians. I was bitter because I'm a Nigerian. I do the same job as well. And like I always say, if you don't have a passion, it doesn't have to be LK. If you don't have a passion for a certain job, you will not be successful at it. You will always find yourself in trouble. But if you're passionate about that job, or if something is going wrong in a job that you love, you will easily recognize that wrong before it gets to a place whereby you can't turn back the hands of time. So obviously that video is still gathering views on my channel right now, and I believe majority of people quite agreed with everything I discussed in that video and for calling them out. So today, it's not only Nigerians that do shitty things in care jobs or social care jobs. There's a video of there was a news about 2 British nurses. This video was, this news was published on the 14th of December. I'm sure it's all over social media, news channel, radio channels. It was on YouTube as well. As about 2 nurses. I'm going to pop their pictures here on each side. So 2 of them, in fact 3 nurses, one being a male. The male was accused of stealing drugs, and 2 nurses were caught discussing how to unalive a patient. So I'm going to pop their pictures here so you can watch, and I'm going to leave the link to the story because it's all over the place. And it's just me coming to talk about this just go to show that it is not only Nigerians that commit all these heinous crimes in care. Anybody from all walks of life do care jobs, and anybody could be caught if you're not doing your job according to the way you're supposed to do it. If you're trained like these 2 nurses, now they went to uni, they know what NMC stand for, they know the codes of conduct, they know the do's and don'ts. Common sense, you know that not liking a resident does not mean you have to plan on how to kill them. No. So let's share the story. So it's about 2 nurses. So the nurse is the one on the left, and the health care worker is the one on my right. So the nurse is the Catherine Hudson, and the care worker is the Charlotte Wilmore. So they drugged residents for their amusement, just to amuse themselves. They were sharing what they were going to do to these residents in a text message. So according to the Sun, I'm going to pop the link in the description box. So one of them said, "What a lovely day I have had in Blue Bay today. Sedated all the troublemakers." That's a nurse texting a care worker that she had a good time today sedating residents who are troublemakers. And I believe these nurses were working with stroke patients. So they were working with elderly patients who have had stroke, and they've been jailed. So the nurse was jailed for 10 years. Yes, jailed for 10. This is a British nurse, UK nurse, born and bred in the UK nurse. So it's just because people are saying Africans, Nigeria. No, all these shenanigans of evil they do. No, it's not specifically Nigerians or Africans who do it. These are UK British people, the people that trained me to become a nurse. These are some of them drugging patients just because they don't like a resident. Just because, I mean, why would you say someone who's had a stroke is a troublemaker? How? Like I said, you've been paid for these services. If you don't want to do it, get out. Get out. So they are ages 58 and 57. So for you to retire in the UK now, she is probably of retirement age. So now she's done that crime. She's never going to get a pension. She's going to spend another 10 years in jail for the shitty things she did. So I'm going to read the story as well. So I'll maybe pop the story here again. So let's say this, just like I was saying, a nurse and healthcare worker have been caged for more than 10 years in total after drugging patients for their amusement. Catherine Hudson, 54, and Charlotte Wilmot, 48, were branded dangerous and callous after being convicted of illegally sedating 2-stroke patients at Blackpool Victoria Hospital. So for some of you out there, don't come here and say, oh, you are calling out names. These names are readily mentioned on national newspaper. So don't come and say, you mentioned the name of the hospital. It's a free information available on the internet, okay? So let's read on. So the pair are understood to have been motivated by their dislike of the victims they chose and a desire to make life easier for themselves. So just because they did not like those 2 patients, they now decided to go on a sedating spree. They're sedating them because they did not like the residents. Police previously said the 6 staff members committed. Yeah, they are definitely sick. Police previously said the 6 staff members committed the acts from February 2017 until November 2018 for their own amusement and out of spite for the patient. Because they spite the patient, they decided to sedate them. Cops launched their probe after a student nurse reported them, and well done to that student nurse who reported. Like, well done. Student nurses out there, keep your eyes out. Just because your mentors are doing something does not mean that everything they're doing is right. Okay, you may not tell them you're going to report, but that's what we call whistleblowing, and well done to that student who reported. So cops launched their probe after a student nurse reported Hudson suggested dosing one victim with an unprescribed sleeping pill and coldly said, well, she's got a DNA. DNA means do not attempt resuscitation in place, so she wouldn't be opened up if she died, or like it if she came to any harm. So obviously, as a nurse, you are not in a position to prescribe a medication. Only if you've undergone the training can you prescribe a medication, and you cannot give a medication that has not been prescribed by a doctor. So for the fact that they are looking after stroke patients, it's definitely a medical ward, so there won't be surgery involved. So the only person that can prescribe will be an advanced nurse practitioner or the doctor or the consultant that is looking after the residents. But this nurse decides to go and give a pill, a sleeping tablet, to her resident because she does not like the person. And then she said that she does not have a DNA, so that means that if peradventure that person she gave the medication to suffers a heart attack or they are in crisis, she's not supposed to do anything to try to save them. And when a patient puts a DNA in place for if anything happens to them, they should not try to be resuscitated. You will find that patients like that, when they pass away, they don't do autopsy on them. Yeah, they don't do autopsy on them because they've already said that if anything happens to me, do not try to save me. So once they pass away, they don't do autopsy on them. And this nurse knows that. And that was why she said that, well, anyway, she has DNA in place. If she dies, they are not going to open her up to find out what actually killed her. You can imagine such a cruel nurse. So these two nurses, these healthcare workers, go back and forth sharing messages in between them. And you know what? And at some point, you will notice that if families believe their relatives are being looked after in hospital, and people are already planning on how to buy them or unalive them just because they did not like them. And when I was a first year student, I was in a hospital ward where it was to rehabilitate patients who have had stroke. I saw a few things going wrong there as well. And I remember I was looking after a man who actually had stroke as well, who used to be a pilot. It was a very good looking man. And then for his age, if I'm not mistaken, I think he was 62. At 62, it looked good, you know. his gate. And when we got talking, obviously it would ask me where I was, and I was telling him I'm originally from Nigeria, and he was like, oh, they used to kind of like get stopovers in Nigeria, and then he would mention the hotel they would normally go to, which is in the days of Sheraton and Hilton, that's when they would normally lodge. And he definitely enjoyed his short times in between flight and landing in Nigeria. And obviously this person suffered stroke. The last one was really heavy, and they had to bring him into hospital for treatment. So he's lost kind of like mobility to his left side, but his right side is still very much working fine. So he was doing all his best. So we used stand A to stand him up. Even though we used stand A to stand him up, it was still an assistance of 2. And I'll see a few times when I'll require somebody else to come join me, and they will all disappear. I won't see any of the healthcare assistants. The nurses and me are maybe busy doing something. At that point, they are leaving me to commit an error. They're leaving me to, or a normal day, for the fact that that resident required 2 assistants, I shouldn't be having to sit that person up on my own, even though I'm using a steady aid, because it says assistance of 2. What if while I'm trying to, because I've got a tool and this person falls and he breaks his hips and he broke his knees, I'll be held liable. But for me, I couldn't do it. And then it's so sad when you say that this person, they've soiled their underwear, they've soiled their trousers, and you're making sure that you're looking to just make sure you get them to the bathroom and get them to, but you can't do that because there's nobody and they're expecting you to do it on your own. So just because people suffered stroke, I don't see them being troublesome. Most of the time they are either lying down or they are sleeping, because obviously they are tired because they are elderly. But what I'm trying to say in essence is that just because you do not like somebody does not give you the authority, does not give you the right to give them medication that have not been prescribed. What if, because you think, and I think the medication they were giving, these nurses were giving to this patient, is called zoplicone. So serious side effect is that it could give you amnesia. It could make you feel or hear things that are not real. It could make you fall. Like you can imagine somebody who already had stroke and they are giving them zoplicone. So if that person tries to maybe get up, and like I'm saying also, people who have had stroke, some of them might still be able to move. Some of them might not have like long-term disability, or so some might just have maybe drooping of the face. Some, it might not affect their mobility, but it has some sort of impact, and some might still even be able to mobilize. But you can imagine giving that to people who are age 65 or over, and even though they have other underlying health conditions, and you're giving them medication that have not been prescribed. What if they react and something major happens? Obviously, because this resident, or this particular resident that was being poisoned, has said that if I suffered a cardiac arrest or anything, do not do anything to save me. So these nurses know that yes, if they were to die, they would not be autopsied. They would not be opened up to find out what happens to them, and their families will be thinking that they died natural death, when obviously it was what these nurses did to them that caused them to harm. So like I said, all these people are British. Remember, these people are British trained nurses. They are in the UK. They were trained by the UK schools. They've had lots of experience. Like from their age, they've been doing this job for a very long time. And so why I brought this issue is that I'm not just coming here to trash Nigerians, because like someone said in the comment I read recently, like, oh, Nigerians this, Nigerians that, Nigerians this, Nigerians that, Nigerians this, Nigerians that. No, it's not only Nigerians. We've seen other African people. We've seen people from all over the Africans as well. If you want me to start bringing such stories to you, I will. In fact, a plenty on my phone, I'll bring it. And this is just the reason why I've tried to come up with that. These are British nurses. They are English people, and look at what they've done. And there are many more. There was the one of Lucy Ledby, the nurse that was killing babies. Yeah, the nurse that was killing babies. I'll pop the picture here and I'll come back and discuss about our story as well. It took so long before they could finally find evidence to nail her to what her other colleagues have been noticing and complaining about her. Medical staffs, consultants, surgeons who were working with her. Some were like, oh, they don't see her as such, but then this is what they've noticed, But still, these people were still made to feel as if, no, they were wrong about this person. But eventually, our lies are wrong. This caught up with her. And she's in jail now. I'm going to come back and share a story with you. We'll discuss it. So, coming out here to call out the shady things our people do, it's not because it's our people from Nigeria. That's why I'm talking about it. I'll be out here to come back and talk about other people It's not a race thing. It's not an ethnicity thing. It's about what we should be doing as an human. If you're in a care job, either as a nurse, as a care worker, if you can't stand looking after people like that, get out of the job. It's not a must. And this is going to you. Either you are an African, either you are a British, whatever, either you are an American, either you are a white, you are a black, you are a brown, you are a yellow, you are a green, whatever race you come from. If you can't stand looking after vulnerable people, get out of the job. You're not being forced to do it. And if I see any story of whoever people they may be in healthcare job that their story is being shared worldwide, I'm going to be coming here and I'll be calling them out. So it's not a matter of just calling out Nigerians. It's about calling out people who are treating vulnerable people wrong. This is the end of my video, and I hope I've made sense with this video. And also, if you think yes, it's right to call out people when they do something wrong, don't try and cover for them. Drop your comment in the comment section before. And if you think no, don't come and discuss about them. That's your opinion, but my opinion on my channel in my video stands because I'm allowed it. So this is the end of my video. Don't forget to like, drop a comment in the comment section, subscribe if you're here to do so, turn on the post notification if you're here to do so you don't miss any other video from me, and share this video as well, because yeah, it's about calling out people who are trying to tarnish the good people who do care work regardless of your ethnicity. Okay, see you in my next video. Bye.